Good morning, everyone. And I'm very thankful for Waze, or I might still be sitting on 75. I don't know if anyone else got caught in that traffic jam, but they were able to get me. Waze was able to get me here a little bit quicker, so I appreciate that. I am the unique combination. I was that government official for many years, sitting behind the desk, crunching numbers, overseeing contracts, and telling my staff why it was important for data entry to be clean and good, and looking at how we can better use our data. And in the past year, I've had the blessing of being able to work with the Art Tatum Zone, which is a newer nonprofit in the Junction neighborhood led by Executive Director Christine Sweeney and President Calvin Sweeney. But with that, I was one of the first employees. And if you know anything about the Sweeney's vision, it's pretty grand. And I was excited to join that team. But with that, they said, okay, you're the first employee. We're hiring you to work with the education sector under this grant in our partnership with Toledo Public Schools. But we also want to work on economic development and health and well-being and neighborhood stabilization and leadership development in the community and community and family engagement. And we're going to grow all of this. And I love that we actually have made some significant progress in the past year. But how do we do that? And how do we use data to do that? Why data sharing is so important for us in the human social service sector. And how, I think Devon had asked me to join today, how we can better work with our government counterparts to get the data we need to make impactful change in our community. So with that, hopefully the slides will be showing soon. Data stewardship is one of the things that we're going to talk about today. I think session is titled Data Stewardship and Policy as Protection. But as speakers, we had several conversations prepping for this event. And we really talked about the value of collecting data and the basics of data before we get into the rest of it, knowing that we may have a wide range of people joining us with different skill sets in data. So we wanted to look at data stewardship and why it's important to care about the data in your organization and what that means, rather if you're the executive director in your organization or if you're a caseworker, why that's meaningful to the work that we're doing. So one thing that Jan and I had shared in our discussion was what data mindset is all about. I have worked with different entities, not necessarily my employer, but some that I volunteered with, where the top level person might be very protective of their data, may not even want to share it with their staff. And how is that going to improve programming? We want to look at data at all levels and how we can improve programming. So Jan also shared the importance of the work they've done at JFS with the data mindset. And Jan, I'll pass it over to you virtually so you can share a little bit about your experiencing in establishing data mindset.
Okay, hopefully everybody can hear me. I just wanted to give you a little bit of a background on Lucas County Job and Family Services. So JFS is a state-funded and county administered, and we oversee public assistance programs, OWF, which is Ohio Works First, SNAP, which is their food assistance program, and Medicaid. Our sister agency is child support. And I know we are sometimes confused with the Ohio Department of Job and Family Services, which is actually ran at the state level and handles the unemployment side of it. So anything that I am going to be talking to or on today will be with the local government agency. And then what we're doing at my agency, we look at data mostly for operational decision making. For example, how many cases do you need needs to be processed today? Or do we need to add more staff to answer the phone? We also look at demographic data. How many adults receive SNAP in Lucas County? And what we find, it's important that our managers and our staff understand the data and utilize it effectively. Currently, we are reevaluating our data reporting processes. Month after month, our managers are providing reports without really understanding the why behind them. So recently I asked the question to one of our managers, how do you know your staff are performing? The answer I received is, I don't receive any complaints. So we know that we need to, at least in my agency, help managers recognize the importance of data, how to collect it, how to analyze it, and use the data that they're collecting to make decisions based on facts and not just feelings. So as we start at the ground level, maybe I will be back next year to tell you how our campaign went.
Okay, thank you, Jan. If you can move to the next slide. We just covered a little bit about shared data mindset and how internally as an organization, everyone can say they're data driven if they produce one outcome or one piece of information. But truly, if you're not using data throughout the policy cycle, it is really tough to be what's truly known as data driven. So yes, those feelings, the qualitative data. Is it important? Absolutely. And I can give you a story yesterday that I heard from one of our staff that's the feel-good story. I will call this young lady Jay. Last year during COVID, we ran virtual learning centers, but we weren't virtual. We were the ones supporting the students in person with COVID safety measures. And we had students report to us in a COVID safe space. And then we worked with all their teachers as they were in the classroom virtually. Now, if any of you have had the experience of helping a child or grandchild on the virtual classroom and know that they all have different start times and different break times and we sometimes had 30 students at a time in one of our 4 centers. So one of the things with data, we said, okay, we've got to put everyone's schedule on a spreadsheet because we can't possibly know when who's supposed to be in what break. But we had one young lady, I'll call her Jay. She did not want to participate in anything, and her behaviors were very defiant to most of our staff. We knew there was some underlying trauma. She was in foster care with one of the foster care moms, and she was just having a really tough time. But at the Art Tatum Zone, we choose to love people where they're at. So regardless of her defiance, we continued to work with her. Even on the day she was screaming in our face, we'd give a consequence, and we would be back there working with her the next day. We created safe words, so on and so forth. So Jay had to go back to or was blessed. She was very excited to go back with her birth mother, and they were reunited. So we didn't get to work with Jay anymore. But one of our staff happened to see her at Burlington Coat Factory the other day. And this staff and Jay probably had the biggest conflict. They would butt heads quite a bit because Jay wanted to push her buttons. She knew she was the strongest staff, and she was going to go in for those buttons every single time and push her buttons and see if she could upset our staff. So Jay, though, told her new foster parent, because she has since again been removed from her home and has again changed schools, which, knowing data, anytime a foster child changes schools, they're looking at being set back about 6 months at least in their education process. But she ran up and gave the staff a hug, and the new foster parent said, "What are you guys doing? She keeps talking about the center. If anything else, she wants to come back. She wants to come back. How do we get her back? How can she come?" So, of course, we're going to work to get Jay reconnected. That's the feel-good story that numbers aren't going to show. However, if we were just serving Jay, we'd be missing a wider range of the need in our community. And as we've worked with some of the schools, We've been blessed to start in the Junction neighborhood, but are now expanding into possibly 10 schools, working in the schools, maybe 11. And that's part of a result of our data sharing agreement and being open with our data with TPS. So hopefully not only can we serve Jay, but we'll be able to serve many, many others. And as we look at our quantitative data at different points, retention rate is so important. And how do we get a case to start, but also to stay with us? And that is one thing that we're constantly looking at from a quantitative standpoint. Now, I can tell you that over the summer in all of our summer camps and summer services, we served some, not every day, but we served over 500 youth during the course of the summer. That's a number, but that doesn't get to the story like Jay. So we really need a combination of how we can use that data together. The quality of data. We all know the data that's being put in is so important, and how we make that easier for our staff. We, being a small grassroots nonprofit, have started using Google Forms, and we'll talk a little bit about the protections involved in Google Forms tomorrow. But we're collecting data from the parents that the parents are putting in and agreeing to share through Google Forms. And any TPS parent, because TPS uses Google Forms a lot, is used to entering data into Google Forms. We have some that can't, so we'll bring them in and we'll work with that. But we get a very large response and quick turnaround. So in June, when Gail Lake said to me, hey, Kendra, can you serve, we're going to open this up and serve some kids at summer camp, but we're opening it up at 4 on Friday and the contract starts Monday. And I said, okay, well, let's see who registers through Google Forms. She released it at 4 that Friday night. We were at capacity by Saturday morning, and by Monday morning we had expanded capacity to accept 150 students into the 2 summer after-school camps that were run into June. With that, though, the parents did all the data entry. So Gail and I just had to sort and figure out logistics. So we also know that that keeps us from having to do duplicative data entry and improves the quality of the data entry. You can easily dump anything from Google Forms into an Excel spreadsheet or Google Sheet, and that helps make it manageable for later statistics and counts. The other thing is using existing data sets, and as Dr. Buskirk shared, there are several resources out there to look at existing data sets. But I'll give you an example. We currently use My Sidewalk to collect data. It's a small contract that we share with one other entity to help have access to this, and they collect data from across the nation from various data sets. So I only have to go to one spot to look for data. And here's an example of some I found when Christine said, well, hey, let's do a housing grant. And as Dr. Buskirk said, my specialty was in criminal justice and cognitive behavior training, not housing. So I was like, what am I going to do with this? But we learned, and I'll read a brief excerpt. The zip code 43604 does have a higher poverty rate than the city of Detroit at 60%. Also, the eviction rate is high at 6.4% in our zip code 43604 that we were focusing on. So it's projected using that rate that over 550 households in 43604 will face eviction within the next year. And I know that in talking with some of the LMHA and HUD officials, certainly we're seeing that crisis in housing. So how as a community can share data and come as social service agencies to be able to serve that better? So it's an estimate, again, based on 2016 eviction rates, and those eviction rates were found at evictionlab.org. Evictionlab.org happens to be one of the data sets, one of the many data sets in My Sidewalk. And sadly, after the moratorium of evictions, and the Blade did such a nice job highlighting that information of what was happening with evicted families, and we've seen it with some of our moms really struggling with evictions. Hopefully we'll be able to provide some support to those families. When we ask on Google Forms, what do you need for holistic care? We're asking about all of those needs: housing, economic support. So when we go to write a grant, we can say, of our respondents in Google Forms, we know this many people need housing assistance or economic assistance, food assistance. We operate one of the largest food pantries in the city. If you know of anyone in need of food, Tuesday nights, 4 to 6, they can come get free groceries. They also can receive free medical care on the first and third Tuesday night at the Tabernacle. So how can we serve our community and help them grow? With that, the next slide, please. The policy process. Do I have any fellow Masters of Public Administration grads in here? Okay, so we had to learn not only the policy process inside and out before we graduated, but we had to learn how to write a logic model in our sleep. I know many of you were blessed with being able to write a logic model for your first United Way grant, and Devon took us through that process, and Andar was pretty helpful. But the logic model I call a mini grant on a piece of paper, and it also takes us through the logic process, or through the policy process. So the strategic phase or the planning phase, and if you Google policy cycle, you're gonna see a million pictures that look like this. And this is one that I did grab off the internet. But there's different variations. But that initial brainstorming phase and the problem identification phase, it's so important to use data versus your gut feeling. I mean, my gut feeling for the housing crisis in 43604 was, yeah, it was gonna be pretty bad. But until I went into the analytics and saw 450 families and using that prediction, I mean, how is our community gonna be ready to respond for that? Those are people. You know, those are our babies that we're seeing come to us at the center. Defining the problem. So once we get once we talk about what we think the problem is, find the data to be able to support that, we have an easy way to define the problem, look at our situation analysis. And that's when you can start really developing, okay, what should we be applying for to help solve this problem, and what funding source? And then developing alternatives to that problem. In the criminal justice field, we looked at race and equity all the time. And I've been studying that for 25 years. But it's quick to point, oh, it's the police officer's fault because they're arresting so many black people. And there is some truth to that, the statistics will say. Or it's the judge's fault, or it's this person. Maybe they're all trying their hardest. But when we started looking at the data, we developed a risk assessment instrument that we started using to control decisions at detention intake. And we saw, after using that instrument, there were equitable decisions made when a person was presented at detention, a child, versus when they were booked upstairs. So many of them started being booked and released to alternative programs in the community. After having 12 years of that data, we saw that, you know, maybe we aren't giving judges enough different alternatives in the community of where kids can safely be served besides detention. We knew that once a child stepped into detention, their risk of becoming an adult criminal grew substantially, and some of them were going in for very low-level crimes. Domestic violence or youth-perpetrated family violence, where the youth was often a victim himself, or safe school ordinance, which was our local ordinance, fading into the school-to-prison pipeline. So the safe school ordinance charge in particular, when we reviewed our 12 years of data, we thought we might need to give the schools a different alternative than just putting them in handcuffs and sending them to detention. And that is when we opened the assessment center. I helped lead that. And it's paid partially by JFS TANF dollars, so thank you, Jan. we opened the assessment center, and just by opening those doors, we reduced Black youth in detention for safe school violations, secure detention behind bars, by 95%, because we came up with a different solution. So that brainstorming process when you're looking at the data is so important, and looking at what's happening across the country and other jurisdictions. Always then looking at your data, reevaluating it. Is it working? Is it working right? At the point of referral, at the point of going active, are you able to retain the children? Those are kind of some of the indicators. But if you know you're losing a lot of people in active status, why? How can you get that information? What's happening? How can you get them back? I'll contend a lot of it has to do with relationship and not giving up on the child, or not giving up on the situation. And then lastly, evaluation. Working with professional evaluators, as Dr. Buskirk said, sometimes the outside eye can see so much more than what you can see in your own entity. So working with evaluators and other people that can give you suggestions of how you might improve. Because after all, when working with people, improving the human condition one person at a time is something the Sweeneys always say. And that's something we want to continue to strive to do to make Toledo a better place. And if we can work together to do that and share data to do that together, I think we'll be that much stronger. Next slide, please. All right, so Jan, you discussed a little about how you use data in JFS and the different type of reporting. I think it's really easy to do the big reports that the grants require. Well, no, it might not be really easy. It's just something we have to do, right? Because who has time to sit down and enter all that data sometimes, or to meet those data requests? But it's something we do. But are we using data on a daily basis to really make decisions? Like, I'm collecting the data of who might need a food assistance, but is my staff looking at that data to make sure that kids or families are really getting the food assistance as well as the education assistance? So using the data on a daily basis is something that's important for your managers. Jan, I'm gonna send it back to you to talk a little bit more about how you're using data. And I know from being a TANF recipient and really breaking down that data process of all that's required in TANF and working for government entities, every piece of data needs to be in line. So Jan, maybe you can talk about how you're using the data daily, weekly, and so.
So again, for daily, we are looking at what actions we pull reports, and it tells us who is at their 30th day for case approval. We want to make sure that whatever action needs to be taken on that case for that day, it's completed. We look at reports on a weekly basis. We want to make sure every week there's something that needs to be done by the end of that week. Again, it's more operational at that point. We also look at monthly reports, performance data, to see if we are meeting the state's performance measures. Are we timely with all of the applications that we are processing? Is our work activities rate at the rate it needs to be as defined by the state of Ohio? And that will tell us, are we doing well? And it's also nice because we get those measures from, we not only pull them internally, but we can pull them across the state of Ohio. So we can look at the measures of the other metro counties to see where we are in comparison to them. And then looking at statistical data, a number of applications we receive in a month, the number of documents that we scan, the number of calls that we receive, and then looking at future planning, future staff planning, Are we going to need more staff in one area versus another? So those are just really just some of the reports that we are pulling. And we just want to compare, are we doing the same month to month? Do we see some type of downward trend in the system? And if we do, what is it caused by? Last year with the pandemic, we saw a lot with the state changed the rules to make it more easy for clients to sign off benefits virtually, so they didn't need to come into the office. Or we saw an uptick in receipt of unemployment, which may cause a decrease in the receipt of cash assistance. So again, it tells a story. You just have to look at it and evaluate it with the factors that are going on to get a complete story of what could be going on at that particular time.
Thank you, Jan. So, creating trust and data trust in our data sets, I guess we. Oh, wait, before we move on, I want to do one more thing here. So, Jan shared how their agency is using the data on a regular basis, but also I want to just emphasize again the importance of collecting data at different data points if you're really looking to improve a program. Again, being referral, active status, inactive status, closure, the type of closure, because so many programs that I've worked with year after year, they lose kids in the referral process, and how can that be improved, I think is a long question. I like to say the intake process is so overwhelming for so many of our families, and how, as we community partners, can work together to do that soft transition. If I'm referring you to perhaps a mental health agency or another program, that if I've been working with you for a while, how can I make that more of a soft transition instead of here's a referral, you take care of it all, and start all over with them. Families are tired. Families are tired of hearing the same questions over and over again. Just like any of us might be tired when we hear the same questions over and over again at a doctor's appointment, whether we're helping a loved one or a doctor's appointment for ourselves. So we kind of need to come together as a community to help our families through that. The other thing Jan mentioned was staffing, and I know staffing is an issue across the country at this point. Talk about predictive analytics. Not sure anyone would have predicted my daughter at 17 was going to be in her second auto accident within 2 months. So we go to get her car in the shop, and of course the parts are sitting on a ship somewhere, and they're even facing the staffing shortage, and they said, well, it'll be the end of December at least before we can get to fixing the car, which I'm really okay with, because I'm going to put her in a bubble and she's not allowed to drive for a very long time. However, when we're looking at staffing, and even as that plays out in the logic model, we can't begin to expect our staff to meet the outcomes if we're not preparing them, if we're not giving them the adequate training, if we're not giving them the adequate resources they need to do their job. So those are all things, those are all kind of the inputs or what we need to think about way up front before we can even think about the long-term outcomes. If we're not able to retain staff or keep staff, put the value in our staff, and get them what they need to do their job, as administrators, those outcomes are not likely going to be achieved. So it's a very important process too when you're thinking about policy. How do we keep those staff and retain them? All right, next slide. So quality assurance If you don't have someone on your team that can do quality assurance for data and really engage, every manager should be a part of this in making sure the data going in is quality, because otherwise the data trust is going to become an issue. Data definitions are extremely important in this. Whether you use a drop-down list and give them a few samples to select from, but make sure the data definitions are clear of what's to be entered in each slot, especially at the point of termination. What is a neutral termination? I have seen this time and time again in programming where they really don't want to name it unsuccessful, so let's just put it in neutral, and then they'll give some reason because, I don't know, his shoelace was untied on Friday, so we're going to put him in neutral. Well, no. If they're truly not meeting the measures of the program and need to be unsuccessful, that's the only way we're going to learn how to improve, is if at closure it's deemed unsuccessful. The other way is we know that just because they may not meet all program needs, they've met several milestones. So how are you tracking those milestones or indicators throughout the process? One thing we're doing for our school student support services in the schools is we're looking at very simple things like, did they receive the choices curriculum that taught them how to make better choices and go through the thought process and complete their worksheets? If they did, they get a check in the checkbox. Did they get their social emotional learning class or spend time on social emotional learning? Yes, check. Did they write the apology letter to their teacher that they told to go somewhere? If they did, check. So even if they may not have met all their academic goals while with us, if we got their social emotional learning and they're making baby steps, we're going to count those indicators as progress. They might not be completely successful, and we know, because undoing automatic behavior takes a lot of time. We know we might be working with this child again, but how can we work with progress through the year? The policy for data entry, our staff are so busy that really creating the time and the expectations for data entry is important. And the trust in daily use and ongoing reporting all helps create that data trust. If we don't have the trust for the data going in, we can't possibly create the trust for the data coming out. And next slide. So the art of asking the question and requesting data. In my world as a juvenile justice, we dealt with data requests all the time. First and foremost, I would encourage you always to go to the agency's website if you're talking about a government agency. Almost every government agency, and I know in Lucas County, Children's Services, Lucas County Juvenile Court, the Supreme Court, Jobs and Family Services, we are all required to have annual reports, and there is a huge wealth of data just in the existing reports. If you're not sure where to find something in the annual report, maybe pick up the phone and call and say, hey, I'm looking for data on gun charges in Lucas County. Can you show me where I can find that in the annual report? And then if they can't, it's the art of asking the question. And you might want to speak with the data person about, well, tell me what type of data you have or how to ask this question. We'd get the question about recidivism all the time. For as many people as are in this room, or many people that ask the question, there's at least that many definitions of recidivism, believe it or not. So your definition in asking and whoever you're asking the data of, you need to agree on a common definition. So find the external data sets available. Go to those first. Oftentimes, they'll give you the information you need, because if you wait, and I say this with love, but the government agencies are also short-staffed, especially since COVID. Their data people, some of them were the first to go. If you ask and make a data request of a government agency, it might be a while before you hear back. Now, with sunshine laws, there is a lot of public information available. And if you have the ability to speak with the data person or someone in the agency to help craft what you're looking for, then you're likely to get a quicker turnaround. They will also probably say, please submit this request to us in writing, because they want to cover their base that they're releasing any data. They'll want it more likely in aggregate form or unidentified form. If you ask a government agency for names of individuals, you're not going to get it, more than likely. So know the agency and a little bit about it, where you're asking the data from. Also, ask them, how would you give us the data? Will it come to us? Can you send it to us in a CSV file? And if you can talk to the data person, because a lot of these requests have to go through the executive director, if it can come from the data person, they'll be able to tell you, I can throw that into a CSV file in about 15 minutes. Whereas sometimes if you ask the executive director, who may not know enough about their system and think that this request is very overwhelming, they might say, no way, we can't do that. But the data person might know if they can. And know exactly what you're looking for and why. That will help be able to craft your data requests to get what you need. I know Jan, and we're at 10 o'clock, so we'll want to wrap this up here shortly, but Jan is providing us with an example of the data request policy at Jobs and Family Services. In closing, Jan, I don't know if you want to speak to that. Tomorrow, Chad Henderly will be here, and we're going to go more into policy and privacy protection, the HIPAA and everything else that we talked about. Chad will talk about what it is at TPS to request data, but Jan, if you want to share what it is at JFS.
Yes, in the interest of time, all of our requests are to go to the executive director, and then it flows down to the person that has that information.
So I would say one of our dreams after many data discussions is that at some point maybe we'll have a centralized data hub where it'll be a one-stop shop for common data requests. So everyone in this room doesn't have to send a request to Jan's executive director, and everyone in this room doesn't have to send a request to wherever else that they want for a subset of data. That we might be able to get that collectively through a shared site that either United Way supports or some other entity supports. But I think that is our pie in the sky vision.